Imagine a patient is sitting comfortably in an air-conditioned room, but suddenly he is drenched in sweat. Is it just sweating, or could it be clue of an underlying disease? Today, let's understand abnormal sweating in just 5 minutes. There are only two types of the sweat glands, eccrine and apocrine. Eccrine glands are the major sweat glands, making up almost 99% of the sweat glands in the body. They are just distributed throughout the skin and mainly responsible for the thermoregulation. Interestingly, eccrine glands are supplied by the sympathetic nerves, but they are functionally cholinergic. Therefore, pilocarpine increases the sweating while atropine reduces it. Apocrine glands are larger and mainly found in the axilla, areola, and anogenital regions. They become active after puberty and respond mainly into circulating adrenaline. Now, sweating can occur physiologically if serve several situations. Thermoregulation are the key function of the hypothalamus, and sweating also regulated by the hypothalamus. Thermal sweating occurs when the body temperature or environmental temperature rises, and it controlled by the hypothalamic thermoregulatory centers. Emotional sweating mainly affects the palms, soles, and axilla. During exercise, both the thermal and emotional mechanisms contribute to sweating. Gustatory sweating occurs while eating, especially spicy food, and commonly affects the head and neck. Now, let's move to the hyperhidrosis. Hyperhidrosis simply means the excessive sweating. Generalized hyperhidrosis can occur with exercise, anxiety, and hot weather, but excessive or unexplained sweating can also indicate the systemic disease. Important endocrine markers in causes include the thyrotoxicosis, acromegaly, menopause, pregnancy, and hypoglycemia. And cardiovascular causes include the acute myocardial infarctions, heart failure and shock, infections and malignancies are also important, particularly tuberculosis and lymphoma. Central drugs and substances that causes the excessive sweating includes the antidepressants, pilocarpines, alcohol, and opiates. Has some important clinical associations. Constant sweating with heat intolerance suggest the thyrotoxicosis, and sweating associations with hot flashes in the women suggest the menopause. And the drenching perspirations, despite of the comfortable temperature, should make you think about the acute myocardial infarctions and or hypoglycemia, especially in the diabetic patients. Hyperhidrosis can also be localized. Excessive sweating of the palms, soles, and axilla may occur with anxiety and embarrassment and psychoneurosis. Localized sweating can also result from neurological lesions involving the brain, spinal cord, or sympathetic nervous systems. Now let's reverse the problem. Anhidrosis means the absence of the sweating. That while hydronephrosis means hyperhidrosis means the reduction of sweating. Generalized anhidrosis means maybe occur in the sweat, heat stroke, ectodermal dysplasia, scleroderma, and hypothalamic disease. Localized anhidrosis can occur in the Horner syndrome and in the diabetic or leprosy neuropathy. One particularly important physical finding is cold and calm skin. It also occurs because of the sweating along the cutaneous vasoconstrictions. It is clinically seen in the shock, but also occur in the hypoglycemia, acute myocardial infarctions, and syncopal states. Now let's talk about the night sweat. Um, 7 night sweating that soaks the bed sheets should not be ignored. Important causes include the tuberculosis, lymphoma, chronic myeloid leukemia, brucellosis, AIDS, and nocturnal hypoglycemia. Menopausal syndromes can also be significantly night sweaters. For example, remember night sweats plus systemic symptoms should particularly make you think of the tuberculosis and lymphoma. Now, three unusual symptoms like sweating and worth remembering. First, osmidrosis. Osmidrosis means foul smelling of the sweat. The sweat itself is usually relatively odorless, but bacterial breakdown, particularly of the apocrine secretions, can make an unpleasant body odor. And second, chromhidrosis. Chromhidrosis means colored sweats. It may be caused by the chromogenic bacteria, pigments such as the lipofuscin, and certain drugs like the lifamycin. Third, Miliaria, commonly called the prickly taste. Miliaria occurs when the sweaty drugs becomes blocked and rupture, producing the vesicles and papules. It is particularly common in the hot and humid climates, and clear vesicles called the pseudomina, while the common popular forms is the prickly taste. Remember, the sweat taste, the pilocarpine allotropes test is used to diagnose cystic fibrosis by measuring the chloride concentration of the sweat. A sweat chloride level above 60 milliequivalents per liter strongly suggests the diagnosis. So let's finish with a rapid revision. Eccrine glands are mainly responsible for the thermoregulations and are functionally cholinergic. Apocrine glands are mainly found in the axilla and anogenital regions, become active at puberty and respond to the adrenaline. Hyperhidrosis means excessive sweating. Think of thyrotoxicosis, menopause, hypoglycemia, myocardial infarctions, shock, tuberculosis, and lymphoma. Anhidrosis means absence of the sweating. Think of heat stroke, ectodermal dysplasia, and neurological disease. Cold, clammy skin means sweating plus vasoconstrictions and is classically associated with the shock. Night sweats should make you think of the tuberculosis and lymphoma. Osmidrosis means the foul-smelling sweat, and chromhidrosis means the colored sweat. And miliaria means the blocked sweat ducts, especially in the hot and humid conditions. So the next time you see a patient sweating excessively, don't just ask how much they are sweating. Ask yourself, when does the sweating occurs? Where does it occur, and what diseases could be hiding behind it? This is how simple clinical science can become an important diagnostic tool. Thank you.